You know that feeling? That sudden, out of nowhere, gotta go right now feeling that sends you searching for a bathroom? Well, that's the feeling millions of people know, but so few of us talk about. It's at the very core of overactive bladder, or OAB. And today, we're gonna dive into what it is, why it happens, and most importantly, what you can do about it. This definition, right here, just nails it. It's not just about needing to pee. It's that sudden, commanding urge that completely hijacks your attention. That feeling has a name. It's called urinary urgency, and it is the single most important symptom, the absolute cornerstone of this condition. So officially, OAB is called a syndrome. And really, all that means is it's a collection of symptoms, a whole constellation built around that core feeling of urgency. It often brings along friends like frequency, having to go all the time, and nocturia, waking up at night. And the key thing to remember is this diagnosis is all about what you're experiencing, once your doctor rules out other obvious stuff, like a urinary tract infection. All right, so here's our game plan. First, we'll get crystal clear on what OAB actually is. Then we'll look at who it affects. After that, we'll explore why it even happens in the first place. Then we'll walk through how you get a diagnosis, and we'll finish up with the most important part, your options for managing it. Okay, let's kick things off. We're going to break down exactly what we mean when we talk about the symptoms of overactive bladder. So OAB isn't just one thing. It's this team of 4 core symptoms. Urgency is the headliner, the main event. But it's often paired with frequency, which can totally disrupt your day, and nocturia, which messes with your sleep. And for a lot of people, it also includes urgency incontinence. That's when the urge hits so hard and so fast that a leak just happens. Okay, this is a super important point, so let's clear it up. Think of it this way. OAB is the story your body is telling you through its symptoms. Detrusor overactivity, on the other hand, is like one specific clue a doctor might find during a special test. And here's the kicker. You can have the whole story, the real symptoms of OAB, without that one specific clue showing up on a test. Your experience is what matters. Now, here's another condition that sometimes gets confused with OAB, bladder pain syndrome. They can look similar on the surface, but the motivation is totally different. With OAB, that desperate rush to the bathroom is driven by a fear of leaking. With BPS, it's driven by a need to relieve pain that gets worse and worse as the bladder fills up. 2 different drivers, 2 different conditions. All right, moving on. Let's talk about who's actually dealing with this. Because if this is you, it can feel incredibly lonely. But I promise you, the numbers show you are so not alone. Just look at this number. 1 in 6. That's huge. Seriously, think about it. The next time you're in a room with just 5 other people, at work, on a bus, wherever, statistically, one of you is managing these symptoms. It is way more common than we think. Now, AOB can definitely affect all genders, no question. But when you look at the large-scale studies, a pattern emerges. It's about 1.5 to 2 times more common in women, and that's especially true for urgency incontinence, that leakage that can happen when a really strong urge hits. And this right here, this is why OAB is so much more than a bathroom problem. It's a life problem. It has this ripple effect that touches every part of your world. It disrupts your sleep, it can chip away at your self-esteem, it gets in the way of work. People start saying no to things they love, social events, intimacy, even just going for a walk, all because of the fear and the worry. The hidden burden is massive. Okay, so we've got the what and the who, but the big question remains why? Why does this happen? Let's get into the science and look at the 2 leading theories. Researchers have kind of narrowed it down to 2 main possibilities. The first one is basically an oversensitive lining. The inside wall of the bladder just gets jumpy. It starts sending "I'm full" signals to the brain way too early. The other idea is the overactive muscle. In this scenario, the bladder muscle itself starts contracting when it's not supposed to, creating that false alarm that you gotta go right now. But it's not always just about the bladder itself. Sometimes it's a communication breakdown. Normally, your bladder sends signals up to your brainstem, which acts like the body's air traffic control. The controller then checks with you, your conscious brain, for permission to go. But with OAB, it's like there's static on the line, or the controller is just sending the go signal without checking first. The whole system gets disrupted. So if you're listening to all of this and it's starting to sound really familiar, you might be wondering, what do I do next? Well, let's talk about getting a diagnosis. You might be surprised by how simple the first steps usually are. The whole process really rests on these 3 simple pillars. It starts with just a conversation, a careful history, where you tell your doctor your story, what's been happening, and how it's affecting you. That's followed by a focused physical exam and then a simple urine test, mainly to rule out other common causes like an infection. Now, your doctor might give you a couple of really helpful tools. One is a bladder diary. It sounds simple, but tracking what you drink and when you go can reveal patterns you never would have noticed otherwise. They might also use some questionnaires to get a baseline score for your symptoms, which is a great way to track your progress over time. And here's some really reassuring news. For a typical, straightforward case of OAB, you usually do not need to start with any big, invasive tests. The diagnosis is primarily based on your story and that simple evaluation we just talked about. The more complex testing is generally saved for later, if it's needed at all. And that brings us to our final, and let's be honest, most important section. What can you actually do about it? The good news here is that there is a very clear path to improvement, with lots of effective options available. Treatment almost always follows this tiered approach. You always start with the first line, behavioral therapies and lifestyle changes, things you can control. If those aren't quite enough, you and your doctor might consider moving to the second line, which is medications. And for persistent symptoms, there's a third line of very effective advanced therapies. These first-line therapies are all about putting you in the driver's seat. This includes things like bladder training, where you literally reteach your bladder to hold more for longer. It's pelvic floor muscle therapy, which is like strength training for your body's support system. And it's making smart adjustments to things like your caffeine intake or even just when you drink fluids. For many people, even a modest amount of weight loss can make a huge difference. Now, if those behavioral changes don't get you all the way there, medications are the next step. Most of them work by essentially telling the bladder muscle to just relax a little bit. This can help it hold more and calm down those sudden, frantic urgency signals. It's always a conversation to have with your doctor to find the right fit. And for those who need more advanced options, there are some amazing third-line therapies. One involves stimulating a nerve in the ankle, which, believe it or not, talks to the nerves controlling the bladder. Another uses injections directly into the bladder muscle to calm it down for months at a time. And there's even a device that works like a pacemaker for the bladder, helping to regulate those haywire nerve signals long-term. So we've covered the what, the why, and the how of OAB. But the real story isn't just about the problem, it's about the potential for improvement. The goal is to stop planning your day around the nearest bathroom, to reclaim your life from that constant worry. So I'll leave you with a final thought to ponder. If you could take back control, what's the very first thing you would go out and do?